Why do most doctors state diabetic neuropathy cannot be reversed? What are they critically missing? Yes, new surgeries and medications are now on the market, but they are far from safe. Do you have to suffer through extreme pain and suffering just because many of the so-called experts still state complications from diabetes are inevitable and progressive? I beg to differ. Welcome to the Resilient Diabetic. This is the channel we turn ordinary, struggling diabetics into extraordinary, well-controlled diabetics. If you are new to this channel, welcome. My name is Jay Sampat. Don't forget to subscribe and hit that gray notification bell. That way you will be alerted when new life-changing episodes have been published. And if you learned something new today, please smash that like button for me. As with all my videos, this should not be considered personal medical advice. This is my interpretation of the latest research. If you want medical advice, please always consult your physician. It has been estimated 60 to 70% of those of us with diabetes have some form of neuropathy. It can develop at any time, but the risks rise with age and the duration of diabetes. The highest rates of neuropathy are amongst people who've had diabetes for at least 25 years. Once developed, diabetic peripheral neuropathy will reduce the quality of life due to pain, then sensory loss, consequently unknown injuries, which is one of the major reasons for foot amputations. One way to look at it is to consider your nerves to be like electrical wires running up and down your body. At the end, you have sensors that respond to the environment around you. When you get neuropathy, that current of electricity becomes unpredictable and or irregular. It may initially come in as flashes, tingling sensations, electrical shock, and for some that can be quite painful, or for others it comes in as false sensations. Your brain no longer translates the signals from the nerves. As neuropathy progresses, the conduction of electricity shuts off entirely, causing a lack of sensation. Even though this tends to be considerably less painful, it is actually far more dangerous. Why? This is when one gets serious cuts, injuries, and infections because your nerves don't indicate that you've been hurt. And then they go untreated, they fester and become far worse. This is how neuropathy can lead to amputations caused by diabetes. Most doctors would say there is no way to reverse diabetic neuropathy because they view it as a natural complication of diabetes. And this, in my opinion, is totally inaccurate. Neuropathy is a complication of what? First and foremost, high blood sugars. The excessive glucose in the blood acts like a corrosive compound, eating away and damaging those nerves, which means the rate of neuropathy falls dramatically with improved glucose control. To be more specific, diabetic neuropathy is actually two diseases, one for type 1 patients and one for patients with prediabetes and type 2 diabetes. For patients with prediabetes and type 2 diabetes, the clinical studies suggest that optimal glycemic control alone provides limited benefits if other underlying factors such as high triglycerides, obesity, hypertension, and smoking are not addressed. Treatments for peripheral neuropathy have been challenging to say the least. But in the past few years, the FDA has approved some medications and devices to help address this growing need. Currently, there are 3 medications on the market approved to help manage pain, although none of these drugs were actually developed with neuropathy in mind. One is an antidepressant, the second is an anticonvulsant, and the third is a chronic pain drug. All of these drugs treat pain in the body in a fundamentally different way. The major problem with this route, the unpleasant side effects and the risk of dependency. In the recent study, Peripheral Neuropathy in Prediabetes and Metabolic Syndrome, they found no one or singular effective medical drug treatment for neuropathy. But they did find one approach that was very successful. And what was that? They found aggressive glycemic control is an effective approach to neuropathy risk reduction in type 1 diabetes. Several other studies suggest lifestyle-based treatments that integrate dietary counseling along with aggressive glycemic control and exercise as a solid approach to neuropathy in type 2 diabetes and prediabetics with obesity and metabolic syndrome. But what was the biggest find? Studies suggest that it is the exercise that is the promising therapeutic strategy, especially when used early in the disease course. They saw neuropathy improvements, not merely a slowed progression, as long as blood sugars were continually in that non-diabetic range. So why is there a disconnect between the diabetic experts who state neuropathy cannot be reversed or cured? It all has to do with the A1C and where our doctors have set the standard for you. Most, including my doctors, have been mandated to keep our A1C at levels where the human body is just not capable of repair and recovery. And believe me, it is actually a bone of contention between my doctors and me. They would like to see my A1C higher than where it actually is. I hope most of you follow Dr. Bernstein. He is what I consider to be that gold standard doctor when it comes to diabetes. I'll put a link to his life-saving monthly question and answer webinars in the description box below. He continually shows that diabetics who maintain normal non-diabetic blood sugars do not develop the long-term consequences like neuropathy. He further teaches and demonstrates that those of us who maintain even slightly elevated blood glucose profiles may eventually experience some of the long-term consequences of diabetes, but they will develop more slowly and likely be less severe than those who have higher blood sugars. From his book, Diabetes Solutions, nerve damage, he states, is not limited to the extremities, but occurs throughout the body. Feet and hands show up first because they have the longest and the most exposed of nerves from the spinal cord to the endpoints. The damage in shorter nerves are there, but not severe enough to show up as symptoms, and this is what most doctors miss. If you did a simple Google search under A1C and peripheral neuropathy, you would see the countless number of diabetics who get these complications when their A1Cs are in the sixes, which their doctors, and mine for the matter of fact, think is a great number. And this is why they state diabetes is a progressive disease and the complications are non-reversible. That is where the main argument begins and ends. It is evident that even an A1C in the sixes is still not low enough for the body to thrive. Damage is still occurring. According to Dr. Bernstein, who has treated thousands and thousands of patients over his career, he feels reducing an A1C and fasting blood glucose levels to non-diabetic levels accelerates the healing process. Now, his A1C target is very low, comparable to most doctors. He wants all of his patients to have an A1C in the high fours. He strongly refutes mainstream medical opinion that damaged nerves cannot repair themselves. His patients take on average around 3 years for complete healing. Dr. Bernstein explained, in a young, healthy, non-diabetic, nerves grow at a rate of about a millimeter per day. The tip of your toe to your spine may be around 1,000 millimeters. That would take around 1,000 days to heal. And if you were in poor health or older, it may be around 2,000 days. If one runs a higher A1C in the low pre-diabetic range, it could take up to 15 years or longer. So, keeping blood sugars very low is critical. He continues to explain, diabetic neuropathies seem to improve in 2 phases. A rapid partial improvement that may occur within weeks, followed by a sustained, very slow improvement that goes on for years if blood sugars remain to be in those normal ranges. Many of his patients with total numbness of their feet have then afterwards complained of experiencing severe pain after several months of near normal blood sugars. This continues for a number of months and eventually resolves itself as normal sensation returns. Nerves will start to generate pain signals while they are in the healing process. The experience may be very frightening if you haven't been warned that this might occur. So in other words, things get worse before they get better. Besides keeping that A1C locked down in that non-diabetic range with the right eating choices, and that is what the Resilient Diabetic is all about. We mentioned in one study, exercise was the other healer. One of the best ways to prevent progression of diabetic neuropathy is to stay active. In one study published in September of 12 in the journal Diabetes and Its Complications, all it took was around 10 weeks of exercise to significantly reduce pain and symptoms in men and women with diabetes-related neuropathy. In that time frame, participants' nerve health and function had also improved. Physical activity not only helps keep your blood sugars in check, it also improves insulin sensitivity and reduces inflammation, but most importantly, increases the flow of blood, of oxygen and other nutrients to those nerve cells, further improving symptoms. Which exercise to do will depend on the severity of the neuropathy, so you must consult your doctor first. So it is always safety first and last. Before and after you exercise, you must do a visual check to make sure that you don't have any blisters or redness from pressure sores. Take those safety precautions, making certain you have the right shoes, the clothing, and other needed gear. To help boost that blood flow while preventing cuts, scrapes, and blisters, I would suggest skip pounding the pavement at first in favor of gentler, low-impact activities such as swimming, cycling, or even using a recumbent bike. What I personally suggest is to focus in on the extremities and do foot and leg exercises for the best blood flow. I am on record stating weight training is critical for diabetics in particular. If you are able to go to the gym, I want you to focus in on what's known as toe or calf raise exercises. If you are unfamiliar, I want you to ask your local trainer to teach you and show you how to do seated calf raises, standing body weight raises, and what's known as donkey calf raises. Remember, you're not looking to go heavy like a bodybuilder would. Use light weight and or body weight. Your goal is to engorge the muscles with as much blood flow as you can. I would suggest doing full body workouts 3 to 5 days a week, and at the end of each day, I want you to focus in on a few, maybe 2 or 3 different calf exercises of 2 to 3 sets each. But if neuropathy is bad and extreme, always do exercises in the seated position. Safety first. Our diets have changed far too quickly for our genes to keep up. The end result is a cluster of conditions that include and are not limited to diabetes, elevated blood pressure, cancer, cardiovascular disease, obesity, and now COVID-19. Life expectancy for the first time in our nation's history has decreased after 2014, and for 3 years in a row, it declined. The playlist I will set up for you next will answer the questions why and the link between all those diseases. If you're on your desktop or laptop, I want you to use your mouse to click this upcoming box. If you're on your mobile device, tap that with your fingers. The first is the link to subscribe to this all-important channel. The second is the link to the playlist mentioned on diseases. So, have a great and productive day, and we will see you soon with another new episode, which are generally released weekly. Bye for now.